The brachial plexus is a network of nerves that gives rise to all the motor and sensory nerves of the upper extremity. This plexus arises from the anterior or ventral rami of spinal nerves C5 to T1, which gives out several branches and also end in a few terminal branches. These terminal branches are responsible for all the motor and sensory innervation of the upper limb, and they include the musculocutaneous, axillary, radial, median and the ulnar nerves. Coming to the components of brachial plexus, they are the roots, trunks, divisions, cords and branches. These components can be confusing and this following mnemonic may help. Rugby teams don't cover bruises. Now this is the spinal cord and these are the C5 to T1 spinal cord levels. They have dorsal and ventral roots that come together to make up the spinal nerve trunk. From the spinal nerve trunk arises a dorsal and ventral rami. The ventral rami from C5 to T1 is what takes part in the formation of brachial plexus. The first component of brachial plexus, that is the roots, hence formed by the ventral rami of C5 to T1, and they are present between the scalenus anterior and medius muscles. The trunks are found in the posterior triangle of the neck, and both roots and trunk are supraclavicular. The divisions come behind the clavicle, whereas the cords and branches are infraclavicular. There are three nerves that arise from the roots, and they are the dorsal scapular nerve that arises from C5 nerve root supplying the levator scapulae, rhomboides major and minor muscles. And all these three muscles arise from the dorsal side of scapula. Hence, the dorsal scapular nerve supplies the muscles on the dorsal side of scapula. And the second branch from the roots is the one you can see descending down with contributions from C5, C6 and C7. This is the long thoracic nerve or the nerve to serratus anterior, which supplies the serratus anterior muscle. Serratus anterior attaches to the costal surface of medial border of scapula, and on its contraction it pushes the scapula forward like in punching or pushing movements. Hence, it is also called the boxer's muscle. During radical mastectomy or axillary lymph node dissection, this nerve can get injured, causing a characteristic sign called the winging of scapula, where scapula fails to move forward and the medial border of scapula goes posteriorly, becoming prominent. C5 also gives a branch to phrenic nerve, which is the third branch from the roots. So these three are the nerves arising from the roots. Each of these roots have a specific dermatome and myotome. Dermatome is nothing but an area of the skin a particular spinal nerve innervates, and myotome is a group of muscles that a particular spinal nerve innervates. So these are the dermatomes of C5 to T1. C5 begins laterally over the arm. C6 supplies the area around the lateral aspect of forearm, thumb, index finger and lateral aspect of middle finger. And you can remember this by holding this sign which looks like 6. Structures you can see in this image are supplied by C6, and if you remember this one point, the rest will be easy and less confusing. And C7 supplies the middle finger, and C8 and T1 supplies the medial aspects as represented here. Coming to myotomes, C5 is associated with shoulder abduction, C6 is associated with elbow flexion and wrist extension, and C7 with wrist flexion and elbow extension. You might have noticed that C6 and C7 have exactly opposite actions. An easy way to remember is that when you flex the wrist and extend the elbow, it makes a 7, which is also C7 myotome's actions. C8 is associated with finger flexion. When you interlock both your hands' fingers in flexion, it gives you a number 8. And T1 is associated with finger abduction. After cords comes the trunk, because rugby teams don't cover bruises. The C5 and C6 roots make up the upper trunk, C8 and T1 joins to form the lower trunk as you can see in this animation, and C7 continues as the middle trunk. From the upper trunk comes the suprascapular nerve, which supplies the supra and infraspinatus muscles, and also the nerve to subclavius. And there are no branches from the middle or lower trunk. Supraspinatus' main action is abduction of shoulder from 0 to 15 degrees, and infraspinatus causes external rotation of shoulder. Both these muscles are rotator cuff muscles or sits muscles, that is Supraspinatus, Infraspinatus, Teres minor and Subscapularis. Supraspinatus causes shoulder abduction, Infraspinatus and Teres minor causes external rotation, and Subscapularis causes internal rotation of the shoulder. So there are 3 branches from the roots and 2 from the upper trunk. From each of these trunks arises an anterior and posterior division. The anterior division gives out peripheral nerves which supplies the anterior or flexor compartment of the upper limb, which means the nerves that eventually forms as continuation or branches of the anterior division supplies muscles of the flexor compartment, and peripheral nerves that arise after unison of the posterior division supplies muscles of the posterior or extensor compartment of the upper limb. The anterior divisions of the upper and middle trunk forms a lateral cord, hence having contributions mainly from the nerve roots C5 to C7. And where do they lie? We had discussed in the previous module, it lies lateral to the second part of axillary artery. The anterior division of the lower trunk continues as the medial cord and has contributions from C8 and T1 nerve roots, and it lies medial to the second part of axillary artery. And posterior divisions of all 3 trunks forms the posterior cord, hence it has contributions from C5 all the way to T1, and it lies posterior to the second part of axillary artery. So nerves which are mainly associated with anterior or flexor compartment are derived from the lateral or medial cords, and nerves that supply the posterior compartment are derived from the posterior cord.